And that was our first report in this episode, and we're going to continue with our guest segment. Of course, you know that exercise is really important for everyone, and with that we have with us to discuss in this matter of fact Dr. محمد القطان, exercise physiologist, assistant professor. We're really happy to have you here as guests in Hala, Kuwait.
Thank you so much.
So at the beginning, if you please could tell the audience a brief introduction about what you do exactly, like your profession itself.
Actually, the exercise physiologist basically means that people who is willing to exercise, I give them the right exercise to do, the right amount, when they exercise, or which kind of exercise they have to do. To get the appropriate dose, they could get benefit, they don't get injured, and they could stop their lifestyle modification.
Yes, and as we all know that exercise has really great benefits to everyone, of course. But the question is, everyone should do an exercise, or there are certain people who actually have to do exercise?
That's true. In the past, many people believe that only two groups of people should exercise, kids and athletes. But the research shows that everybody has to exercise. In order to prevent from chronic diseases and to treat the chronic diseases. We have a lot of chronic diseases spreading all over the world, such as diabetes, obesity, heart rate problem. And this is the best way to do it, is to do a lifestyle modification such as exercise. So everybody has to exercise. And I highly recommend it the general population to exercise.
So as you were mentioning about chronic diseases, these kind of people who has these kind of diseases, can they actually do exercise, or there are certain exercise for each kind of a disease itself?
That's a very good question. Now, many people who are willing to exercise, their doctor tell them just to go walk. But for certain people, they could not walk. For example, if you take obesity, people who have overweight, they probably walking is not a good mode of exercise for them, because they're hurting their knees and they're putting a lot of mechanical load on their knees, and maybe they could develop osteoarthritis. So for this case, for example, they could do swimming, they could do cycling, they could do rowing machines. They have a low impact on their joint, that could do exercise in a longer way.
Yes. Well, as you mentioned about obesity itself, as you said, most people, or let's say the nutrition side, they always recommend for them to walk. They never, most probably, nobody actually tells them there are varieties of exercise to do. It's they tell them to reduce the amount of food and try to walk.
Correct.
So yeah, as you were mentioning, I guess, yes, having different varieties of exercise, especially telling this kind of patients that there are actually something, let's say, a replacement than walking,
Absolutely.
And I guess they will start actually to go swimming much better, because as you mentioned, they will not feel the effort like walking and such on.
Correct. This is my strategies actually to reduce calorie intake, daily calorie intake. They could reduce their weight, and they should do non-weight bearing activity exercise, like I just mentioned, swimming or cycling. When their weight getting low, they actually could walk. But I don't highly recommend when they have a really heavy weight, they could walk. This is a good strategies to lose weight, then go walk or do jogging, or what we call the weight-bearing activity exercise.
Yes, and do you recommend for obesity patients to, let's say, start reducing first with nutrition, and maybe then when they start to lose the amount, let's say the better amount for them in order for them to do workout? Do you advise on, let's say, first losing weight through nutrition and then going to exercise, or it's together?
This is actually one of the most common questions that I get from clients. Now, obesity is, we have a big percentage in Kuwait who have, people have obesity. So for my advice for them and for my clients, what I recommend is just reducing the calorie intake, but not too much. Because when you do exercise, you need energy. So if you reduce the calorie intake too much and you do exercise, you're going to really burn them out. So my advice for you is just try to reduce their calorie intake just a little bit and exercise. Because exercise is the best way to maintain their body weight. If you do a diet, you're going to reduce your weight very fast. It's a really effective way to reduce weight. However, when you reduce your weight very fast, there is another chance that you're going to gain this weight again at some point. So my advice is to really reduce your calorie intake just a tiny bit and do exercise. When you do exercise, you're going to increase your muscle mass. So while resting, you're burning more calories. This is why I highly recommend exercise for obese people rather than diet. So this, and for the future for them, if we talk about after 5-10 years, they're going to still maintain their weight, not really reducing really fast and going up. And this is actually my advice for them.
Yes. And if we talked about chronic disease in general, like as we mentioned, there are like diabetes and like obesity and such on. Like each kind of chronic disease has its own specific, let's say, exercise, or it's fine, like everyone can take or pick any exercise they can.
This is another thing. Now, people who have a chronic diseases, they have to really talk with exercise physiologists. If I have a healthy person, they don't have any problem, then they could do whatever they want. However, if you have a chronic disease, you have to really consult with an exercise physiologist, because let's talk about osteoporosis. Now, if I have a person or lady who has osteoporosis, and it's not good for them to do swimming or cycling, because swimming or cycling is not a good way to improve their bone mineral density. So I give them walking.
Yes.
Walking is a way better mode of exercise to improve their bone. So, and weightlifting. Weightlifting is the best mode of exercise to increase your bone mineral density. So this is why, this is just an example here. Let's talk about osteoarthritis. If you have osteoarthritis in your knees, it's a good way to walk? No, it's not a good way to walk. So you have to do a non-weight bearing activity. How long? This is going to be another issue. Some people have to work 3 days to work out 3 days. Some people have to work 5 to 6 days, such as diabetes. People with diabetes has to really exercise more frequently. Yes, frequently in exercise in diabetes is very important thing to do. So they have to do at least 6 to 5 days a week. So if I have osteoarthritis patient, they only could do 3 days. So how much do you know? Could you tell how that's different? Every person has their own routine of exercise. They have to get the right dosage of exercise in order to treat them. If you get more exercise, they could injure them. If they get less the dosage, they might not be benefit for them, and they could give up. You know, that's why I say I've been exercising. I have many patients. They ask me, I've been exercising for a long time. I don't get any benefits, so I'm not going to exercise because exercise is not going to work for me. Absolutely, if you don't get the right dosage, you're not going to get any benefit. So this is my role here, to give you the exact dosage of exercise, which kind of mode of exercise, time. For example, how many minutes do you exercise? 20, 30, an hour a day. Frequency. 3 days, 5 days, 6 days, every other day? Do you take a break? This is going to be the really most important things you have to be considered in order to exercise.
Yes. As we're talking about exercise when it comes to people who has chronic disease, but for the healthy, let's say, person, like how can they actually know what is the right exercise for them?
Good.
Yes.
It depends on their condition as well as on their goal. If somebody came to me and asked me, I want to really add more muscle mass, then they have to do resistance training. Actually, I have one of the clients came to me and told me, diabetes run in my family. I would like to prevent it. So they have to get a different mode of exercise. However, in general, the American College of Sport Medicine, the most famous sport and exercise organization in the US, they recommend the dosage of exercise that people have to exercise at least 3 days per week for 45 minutes per session with moderate to high intensity. This is for the general population. However, now, if you are fit, you have to exercise more than 3 times per day because you want to add more. You want to increase your health. You want to increase your muscle mass, your heart going to function better, so you have to exercise more. Some people, no, I have to really exercise them more in a certain period, then after that they have to reduce their load. I don't want to burn them out. So this is why it's very important to know exactly what's the right dosage for you. So to answer your question, is that in the general population, at least you have to exercise 3 times per day for 45 minutes with moderate to high intensity.
So I just heard you saying, and correct me if I was wrong, like if a person is really fit and wants to really work out more, he can like work 3 times in the same day, right?
He could do twice. Some people
yes.
could do 3.
But like, are there like a certain like let's say hours? Like, does he have to work, let's say, twice, like for 2 hours a row, or he has like to have a break between each exercise, or how does it work?
It depends on their intensity. If you're going to do a high intensity, they had to do at least at minimum 30 minutes per session. If they're going to do, for example, really moderate exercise, such as jogging. Jogging is considered to be a moderate exercise. They could do an hour and a half. Then they could take a break. It doesn't matter how long they break. And they could do another 1 hour and a half of jogging.
It depends on the person itself.
Absolutely, and as well as the intensity. If you do very high intensity, you have to do really short period of time. Because the body could not really generate a lot of power and energy to really keep up with the high intensity. So 30 minutes is enough. Then you take a break. The body, the human body, could really generate and rebuild the phosphate, creatine, ATP, ADP system. Then they could do the second round of exercise.
Yes. And if we want to talk about exercise and healing some kind of, let's say, chronic disease, like does it actually work when it comes to that part?
Yes. There are some chronic diseases which actually exercise could treat them, such as diabetes type 2. Now, you know, also we have a lot of people who have diabetes in Kuwait. Now, the good news is exercise could treat you. You could leave your pills as well as your injection. However, you have to exercise. You have to exercise in the right amount, and you could be a normal person.
That's really great.
Yes, this is really good news. For other chronic diseases, you could stop the progression of the disease. That's such as Alzheimer's disease. You could cognitive function. If you have Alzheimer's disease and you exercise, you're not going to let the disease to grow. Because if you have it depends on your stage.
Well, that's really great, knowing that exercise actually could heal such kind of chronic disease.
Absolutely, absolutely.
Well, thank you very much, Dr. Muhammad, for your time. It was really a pleasure having you here. Hopefully, we'll have you in, let's say, a different episode to talk more about exercise.
Absolutely. Thank you so much.
Yes, thank you
Appreciate
very much.
it.
Thank you. So we're heading to our second report in this episode, which is a report on first project on online DGA. So we're going to check that report, and then we'll be back.